First, I just want to say thank you so much for coming out. I know this is our first official snow day, and you were all just scratching at the bit to go out there and make snow angels, and you instead came here, and I really appreciate that. This is put on by War Memorial Hospital, SHAC, which is Community Health Access Coalition, and the League of Women Voters. And you may not be familiar with the League of Women Voters. We are a new group here in the Sioux. The last time the League was in the Sioux was in the 70s. And so if you're unfamiliar with what the League is, we're a nonpartisan organization that does voter services. And so this would be considered a voter service event because we have a law and we're trying to learn about this law. And whether you like this law or not, it is a law. And if you don't like it, you have representatives that you can tell them that you don't like the law. And we also have some other events coming up. This Saturday is the City Commission Candidate Forum, which will look very similar to this. We'll have food, we'll have coffee. It'll actually be less formal in that our candidates will each have about 5 to 10 minutes to have an introduction, and then everyone will get up and eat and chat and ask your candidate questions that are pertaining to the city. And then November 9th, we have a hydraulic fracturing event coming up. And then on December 2nd, we have Common Core State Standards, which is about education and the state's initiative. It's a new policy. It's not really new. It's a policy about how the state is trying to encourage more standardized curriculum. And so that's what we have down until the end of the year for the League of Women Voters. Other things that the League does is we help register voters. We help take people to their polling place, give you directions, tell you what's on the ballot, initiatives, referendums, things like that. And so if you like those ideas, those things that the League does, I hope that you'll ask questions. I am a League member and Melissa's also a League member. And we have a table out there with cards and brochures, flyers, and so please feel free to pick them up and learn about the League. And so that's that about the League. I'd like to introduce my guest. This is David John. He's from the War Memorial Hospital. He's been working in hospitals for the last 25 years in the UP, and he's worked over 8 years at War Memorial Hospital. He also sits on a board for the Consumer Mutual Insurance of Michigan. He was recruited for that as a board member, which is one of the participating health insurance exchanges, and he'll talk more about that in a little bit. And then we also have Andrea, and she is the program manager for the Community Health Access Coalition. I always want to mess that up, Jack. And that's a nonprofit volunteer organization that coordinates the access of healthcare for uninsured residents. And they've trained navigators. So if you are unsure of how to find the right insurance, their program, their organization will help you find the right insurance, which is really, really helpful. And so I hope that if you have questions, make sure you ask both of our wonderful guests. What we'll do is each guest will come, they'll talk about their topic, and then afterwards, if you have questions, please feel free to ask. If you don't want to ask out loud, we have cards, and I can usually come in and pass those around. Otherwise, just raise your hand. So, all right. Please come up and take a seat.
I'll stand up. I've been sitting all day. Well, thank you for coming to tonight's meeting. I want to make sure that I do my disclaimer first, which means whatever I tell you right now could change tomorrow as soon as the federal government decides what they want to do with the Affordable Care Act. I mean, it is what it is right now, but we got through the first crisis of the budget, and you know, they kick the can down the road another month, but before the end of the year they're going to have to make another decision. So the information I'm going to give you tonight is what we know as of right now, but it could change as well. So you have a handout. We printed handouts instead of a PowerPoint because I think some of this information you'll want to take home and maybe study it a little more. But if you go to the second page, page after how will this affect you and your family, you'll see that effective on January 1st, 2014, the individual mandate will go into place, which means all citizens that meet certain criteria will have to purchase health insurance. Now, also on January 1st, 2014, there was supposed to be an employer mandate that went into place, which would say that all employers over 50 employees would have to provide health insurance to any employee that worked 30 or more hours per week. But that was delayed during the summer by Congress or the administration, and that won't officially take effect now until January 1st, 2015. So when I say it's a very fluid situation, even with the individual mandate, that might change before January. So if you look at where it says healthcare reform individual mandate, and this is how you will determine whether you need to purchase health insurance or not. So if you are an individual with a religious conscientious exemption, which generally means you're opposed to accepting benefits from health coverage for religious reasons, if you're a member of a healthcare ministry, if you're not a citizen of the U.S., if you're not lawfully present in the U.S., if you're incarcerated because you were convicted of a crime, if you are a member of an Indian tribe, if you're unable to afford health insurance, if you are someone with household income below the income tax threshold of $9,500 for an individual, $19,000 for a married couple, or if you're experiencing a gap in coverage of less than 3 months, you won't have to purchase health insurance and you won't be penalized. So, you know, if you're not one of those, and then if you go to the next page, if you are on Medicare, Medicaid, CHIP, which is Children's Health Insurance Program, TRICARE, employer-provided health coverage, veterans health coverage, if you have an individual health policy, if you have a grandfathered health plan, or if your health care is provided as a Peace Corps volunteer, if you're any one of those, you will not have to pay the penalty because you're covered by insurance. But if you're not somebody who's on those first 2 pages, you don't have employer-sponsored health insurance, you don't have Medicare, you don't have Medicaid, you don't have your own individual policy right now, then you will have to purchase health insurance or pay the penalty. So if you go to the next page, you'll see what the penalties are. In 2014, the penalty is the greater of $95 per adult and $47.50 per child in your household, up to $285, or 1% of your household income that exceeds your tax filing threshold. So some people, I'm sure, are going to say, well, I'd rather pay the penalty than pay for the health insurance. But in year 2, 2015, that penalty goes up to the greater of $325 per adult, or $162.50 per child, up to $975, or 2% of your household income. And then in 2016 and beyond, it goes up even further to $695 per adult and $347.50 per child, or up to 2.5% of your income with a cap of $2,085. So you always have the choice, instead of getting health insurance, to pay the penalty. But it gets more expensive each year you move forward. Now, how can the Affordable Health Care Act be affordable? That was the idea: provide coverage to all and make it affordable. Well, how it becomes affordable is there are tax credits that you can file for and get to help reduce the cost of the health insurance you would have to purchase. So the tax credits will reduce the amount of income tax you owe to the IRS, or you can use the tax credits to go directly to the marketplace and buy health insurance. Now, the marketplace is all the health insurance exchanges that will be operational in the state of Michigan. I think there's 12 that have filed to be exchanges. As you all know, when we live in the UP, we don't get quite as many choices. And there's 3 that will operate in the UP. One is Blue Cross. One is a company called Bloom, which is a subsidiary of Blue Cross, and the other one is Consumers Mutual Insurance of Michigan. Now, Consumers Mutual Insurance Company of Michigan is a public exchange. It's not a private exchange. They were created to provide choice and competition in the marketplace. The federal government loaned Consumers Mutual $90-some million to start this insurance company up and to provide competition, because we all know in the state of Michigan that Blue Cross has the majority of the market share, and it's very hard for anybody else but Blue Cross to get contracts with hospitals and physicians, and therefore, when you go look for somebody to compete with Blue Cross on premium, you don't have much of a choice. So this Consumers Mutual will give the people in the UP a choice. Now, when you go and sign up for an exchange, you have to be careful because I said there's 12 exchanges in the state. Make sure you're getting an exchange that actually has provider and physician contracts in your area, because you could potentially sign up for a contract of a company that's down in Grand Rapids, say, and you'd have to go get your health care in Grand Rapids. And that's where I'm sure Andrea will let you know when she talks about the navigator and how they can help you through the process to make sure that you're signing up for the right area and that there's providers in that area. So if you go to the next page, you'll see how the tax credits work. Well, tax credits are either paid directly to the health plan or they're adjusted at your actual income tax time. Now, I'll show you another example later on, but I have a hard time thinking anybody would want to have their tax credits adjusted at their income tax time, because that means they have to go all the way to April of the next year to get their refund. I would think most people would want that tax credit paid directly to the exchange so that your monthly premium would be lower from the start of the year. If you go to the next page, you'll see at what income level tax credits are available to help with the cost of the insurance premiums. If you're an individual that earns below $45,960 a year, you will be eligible for tax credits. If you're a family of 4 and make less than $94,200, you will be eligible for tax credits. Now, obviously, the lower the income, the more tax credits you can get. So if you're closer to those high ends, you will get probably not a lot of tax credit. But to figure out what your tax credit would be, you could go to that website there that gives a calculator based on your income, so you could get an estimate of what your tax credit would be. If you go to the next page, we talked about will health insurance be affordable. These plans that you will be able to choose from are called the metal plans, METAL. Bronze, silver, gold, and platinum. And the basis for this tax credits is the silver plan. Now, the silver plan pays 70% of the cost, and then you would be responsible for 30% of the cost. If you choose the bronze plan, that only pays 60%, you'd be responsible for 40%. If you choose the gold plan, you would pay 80%, you would be responsible for 20%, and the platinum plan pays 90%, and you'd be responsible for 10%. Now, there's a lot of people in the lower income brackets that won't be able to afford that copay, that 30% copay or 40% copay. So there is the ability to get subsidies to help pay for the cost sharing piece, and those are only available to the lower income individuals. So if you're making less than $28,725 as an individual, you will not only be eligible for tax credits to pay the premium, but you'll also be eligible for a subsidy to help in the cost sharing. And if you make $58,875 for a family of 4 or less, you'd be eligible for those subsidies as well. If you go to the next page, you'll see that these premium credits, or tax credits, will help assist in purchasing health care coverage in the new marketplace. They start January 1st, 2014, and they're administered through the tax system, just as the penalties are administered through the tax system. So if you choose not to pay for health insurance and you have to pay a penalty, you'll have to pay that on your income tax at the end of 2014. The next page, who's eligible for the premium tax credits, you can see individuals and families between 100 to 400% of the federal poverty level. You must be a U.S. citizen or lawfully present in the U.S., and you must not be eligible for other minimal essential coverage, meaning other coverage by Medicare, Medicaid, employer-sponsored, the list I went through earlier. And lawfully residing immigrants with incomes below 100% who are not eligible for Medicaid because of their immigration status. Now, it's all based on your modified adjusted gross income. So how do you calculate that? If you look at your last year's income tax and look at Form 1040, line 37, and if you add foreign income, tax-exempt interest, and non-taxable Social Security benefits, when you add that all together, that's your modified adjusted gross income. And then it's based on your household size, with the household equals your tax unit. So if you're when you file your income taxes and you're a husband and wife and you claim 2, your household size will be 2. If you're husband and wife and 2 kids, you'd have a household size of 4. So it's right off of your income tax return. So on the next page, how is the amount of the tax credit determined? Well, you take your credit amount is going to be equal to the cost of the benchmark plan minus the expected premium contribution. So the benchmark plan, because the silver plan is the benchmark, but they don't base your tax credit off of the lowest cost silver plan. It's based off the second lowest cost silver plan. So and I'll show you some examples of that. So if you go to the next page, you'll see income and what the expected premium contribution is for each individual. As I said, the lower income you are, the more tax credit you'll get, and the less you'll have to pay out of pocket. You can see anybody at 100% of the federal poverty level is only going to pay 2%, and at the top end, you're going to pay a maximum of 9.5%. So on the next sheet, it gives you an actual table based on the poverty level and what your income would be and what your expected premium contribution would be, and how that relates to the dollar amount. And again, you can see the footnote number 2, these are based on the second lowest price silver health plan in the exchange. So now if you go to the next page, we'll give some real life examples. Okay, John is age 24, and the cost of his plan is $5,000. So an example of how that would work is that if his income is $22,980, his expected contribution off of that table would be 6.3%, or $1,448 for the year. So he would get premium tax credits of $3,552. So he's going to pay just a little over $100 a month for his health insurance. If he earned 300% of the federal poverty level, or $34,470, he'd have to pay 9.5% of his income, or $3,275 as his share of the health insurance cost, and his premium tax credit would only be $1,725. So as your income goes up, your tax credit goes down, and you're responsible for more of the premium yourself. Now if you go to the next page, you'll see this is a little example of how they determine what your cost of your plan is. Again, John's 24 years old, $22,980 his income. He's going to pay $1,448. He went out to the exchange and he got three quotes from the different exchanges. You can see the Plan A was a quote of $4,800 for the year. Plan B was $5,000. Plan C was $5,200. So they're going to take the second lowest cost, or the Plan B, and that's going to be his basis for his premium tax credit calculation. And that's where you take his $5,000 minus his $1,448 personal contribution to get to the tax credits of $3,552. If you go to the next page, you'll see this is an example of a family of 4. They make $52,988, or 225% of the federal poverty level. So based on the chart, they would have to contribute 7.18%, or $3,802. They went out and got quotes on the exchange. They have 3 quotes there, so you're going to take the second lowest quote for the silver plan, which is $15,000. They're going to have to contribute $3,802, so their tax credit's going to be $11,198. So their contribution to the premium, $3,800, they would have to pay about $300 a month for health insurance. If you go to the next example, there are a few caveats to that. So the household may have ineligible members.
Yeah.
An ineligible member would be, in this case, 2 of the children are on CHIP. So they wouldn't be eligible because they're covered by the CHIP plan. So again, their cost for 2 people is less than a 4-person policy. So you see the second lowest cost of the silver plan is $10,000. Their contribution though would remain the same because their income is the same. So they would get $3,802 of personal contributions now on only a $10,000 policy. So their tax credits would be less. So that individual contribution, it doesn't matter how much your policy is, you're going to still have to contribute that amount to that health insurance coverage. If you go to the next one, we know there's a lot of people who have children that are off at college. So here's ineligible members or eligible members residing in different locations. So you take that same family with the same income, the son goes to college in a different part of the state. So they're going to have to actually buy two different plans. One is going to cover mom, dad, and daughter. The other one is going to cover the son who's off at college. In this case, the second lowest cost silver plan for mom, dad, and the daughter is $12,500. The second lowest cost silver plan for the son off to college is $3,000. So you can see that 12,500 plus 3,000 minus, again, the same amount for their contribution, 3,802, means their tax credit will be 11,698. Yes?
Could I stop you for a minute? Can you please explain one more time about the benchmark? What is the benchmark?
The benchmark is the second lowest cost silver plan.
No, I understand that, but can you define benchmark for me again? What is it a benchmark for?
The benchmark is for your tax credits. They're going to determine your tax credits off the second lowest cost.
Regardless of what you end up picking.
Right, and I'll get to an example of that, because you're gonna get tax credits. You could apply those tax credits to a platinum plan, or you could apply them to a bronze plan. And based on the cost of that, you'll have either more personal contribution or less personal contribution. And there will be an example coming up, so hopefully that will explain that. But if not, I'll get back to it.
Thank you.
And also, one of the things that the Affordable Care Act does is provide coverage for all, and it doesn't allow insurance companies to use pre-existing conditions to determine your premium. A lot of times people were denied insurance because they have pre-existing conditions. You can no longer be denied insurance because of pre-existing condition. It also allowed insurance companies to rate based on age and on smoking status. And they could rate however they wanted. But the Affordable Care Act says there is a limit to how much you can charge an older individual for coverage and how much you can charge a smoker for coverage. So this next page shows you that the age limit, you cannot charge somebody who is an older adult more than 3 times the rate that you have for the youngest adult. And you can't differentiate by geographic area either. So some real life examples of that, if you turn the page, you'll see now John, who when he was 24 paid $5,000. His premium for health insurance cost $5,000. His premium credit based on his income was $3,552, so he paid $1,448. Now if you took that same person and made him 64 years old, the cost of his premium for health insurance could not be more than 3 times what he was at 24 years old. Now remember, this is in the same year at the same time. 40 years later, I don't know what the system will be, but this is if you took a 24-year-old today, John, and John, his grandfather, was 64 years old, that would be the difference in what the maximum they could charge the 64-year-old John. But because his income is the same when he's 64 years old, or the 64-year-old, if he has the same income, his premium tax credits are going to go up significantly because his premium went up significantly. So you can see in this example, grandfather who's 64 is going to get $13,552 of premium tax credit because the policy is 3 times higher. So whether you're 24 or 64, based on your income, you're not going to pay anything more for your personal share of that premium. And then if you turn to the next page, you'll see the variation for tobacco use. Insurance companies or exchanges can't charge more than 1.5 times what a non-smoker would pay. So if you turn the page, you'll see John is a smoker and John is a non-smoker. John is a smoker, his premium was $5,000. If John started smoking, that same insurance company couldn't charge him over $7,500 or 1.5 times his non-smoker premium rate. Now the thing with this though is his premium tax credit still stays the same because it's based on income. So you are, as a smoker, going to pay more for your personal share than you are as a non-smoker. And you can see here, John as a non-smoker would only have to pay $14.48, but if John smokes, he'll have to pay $39.48. So in this case, $2,500 more this person will have to pay because they smoke. Because tax credits don't change, it's based on income. So now, hopefully this is the example on the next page that will answer your question. If John chooses the benchmark silver plan, which is the second lowest cost silver plan, and we've gone through these numbers before, he's going to pay out of his pocket $14.48 and he's going to have $35.52 in tax credits. Now he could choose the lowest cost silver plan. So in that case, the tax credits remain the same and he actually pays $200 less because the lowest cost silver plan was $200 less. Now, most people are probably going to pick the lowest cost plan and get a benefit of not having to pay as much out of their own pocket. Now he could also choose the bronze plan. And the bronze plan cost was only $3,500. Since his tax credits are more than the $35.52, or since his tax credits are more than the premium cost, he wouldn't have to pay anything out of his pocket. But you don't get the $52 back in a refund either. Okay? And then if he chose the higher plan, the gold plan, which is going to cost more, in this case, the gold plan cost $6,600, $6,500. Again, his tax credits are going to be based off his income. They're going to be $3,552. So he'd have to pay more out of his own pocket to get to the gold plan. So the biggest thing to remember is that your tax credits are going to be based on your income. And then you have a variety of choices on what policy you're covered by. You could choose a bronze policy, you could choose a silver policy, you could choose a platinum policy, but it's all going to impact how much you pay out of your own pocket for that health insurance coverage.
Could I interrupt you for just
Sure.
1 minute, if you don't mind? Can you tell me what it would look like, for example, what the co-pays and doctor visits might be for the benchmark silver plan, the lowest, and the bronze and the gold plans?
The silver plan is 70-30, so the insurance will pay 70% and you'd be responsible for the 30. The bronze plan is 60-40. Coverage would pay 60%, you would pay 40%. The gold plan is 80-20. The health insurance plan would pay 80%, you would pay 20%. And the platinum isn't on here, but the platinum is 90-10. Now, when you're looking at which plan to buy, certainly some of that will be based on your health and how much, if you're a young, healthy adult and are invincible and never think you're going to get hurt or need surgery or anything, you're probably going to buy the bronze plan. Because you don't have to worry about the 40%. But if you're somebody that has a pre-existing condition or a chronic disease process or anything like that, you're going to have to decide what have my health insurance bills been for the last year, and does paying a higher premium for the insurance mean I'm going to actually be ahead of the game because I only have to pay 10%, or paying a lower premium would be better and I'll take the risk of paying the 30% deductible or copay or the 40%. Yes.
Does dental and vision include this health plan? Or is it
No.
just medical?
Medical.
When you talk about the percentages, is absolutely every service that you entail covered in those percentages, or is some of the preventative health care covered at 100%?
The minimum essential benefits have changed. All insurance companies now have to provide a minimal set of benefits, which some employers and their employer-provided insurance didn't have before. So there are some wellness benefits in there. Now, part of how they're paying for this, like War Memorial Hospital, we have 900 employees and I think 600 are covered by health insurance. this year our health insurance premium went up $1.2 million. And $500,000 was new taxes to help pay for the Affordable Care Act. So, you know, when you say who's paying for this, a lot of employers are getting, ours was 18% increase. I've heard some as high as 40% increase in their health insurance they're providing for their individuals, their employees. And some of it is that you have to have a higher benefit package too, because some of these things are being covered. For example, there's a lot of women's issues that I like mammography screening after a certain age, or colonoscopy screening for men and women after a certain age. There's some wellness benefits in there where you won't have to pay the deductible for these wellness benefits. Now you'd have to go when you're signing up for your plans and make, you know, because some plans will be different. Some will offer the minimum, some will offer more than the minimum. So you'll have to determine which plan you'd like to choose, and that's what makes it really complicated, because I'm in healthcare and I went up and signed up just to see what the rates would be, and it takes you quite a while. And I know Andrea will talk about being a navigator and helping you through it, but there's going to be a lot of confusion of what's right for me, what's right for my family, which plan do I choose to buy. Yes.
In your example where John is a heavy smoker,
Right.
If he gave up smoking the next year, do they do a look back and then adjust his premiums accordingly? Or can they charge higher because he was a smoker last year, or does that pre-existing condition start all over again in the year that he changes?
I would assume that if you stop smoking, you would get the non-smoker rate, but I haven't specifically read up on that, because I don't think they can hold it against you for the rest of your life. There's probably a time period there. Mm-hmm. There may be some insurance companies who say, okay, you need to prove through a blood test or whatever, because you can find out whether you have nicotine in your system or not, and they may randomly say, okay, we're going to prove this because you were a smoker last year and you're saying you aren't now. Let's see if you have nicotine in your system, because it's just not smoking; it's any tobacco use. So it could be chewing too.
Or pipe.
Right. So if you go to the next page. Yes.
Is prescriptions included in that
Yes.
wellness thing, or is it the 60/40?
It's in the
bronze
60/40,
thing? Okay.
70/30. Right.
And that will also be dependent upon the insurance policy you select, because some of the insurance policies are offering some medications as part of their wellness.
Right.
So they would be at no cost.
That makes sense. They want you to take your medication.
Right.
to stay
But
well.
again, that's dependent on the policy. So each policy it'll be a lot of reading and just understanding what you need, what you personally need.
Right.
Thank you.
So how do people get the premium credits? You submit an application to the marketplace, which Andrea will go over here shortly about how you do that. The marketplace estimates the amount of your advance payment based on your projected income, and the credit is sent directly to the insurer, meaning the company, not you, or the individual can just pay the premium monthly and get the tax credit after tax filing. So here's an example of what that means. If you take the tax credit in advance, and in this case we're using John again, so you take the $3,552 tax credit, you divide it by 12, that means he's going to have a $296 a month credit. Now his cost of his plan is $417. So if he chooses to have that credit sent directly to the exchange, he'll pay $121 a month for his insurance, and he won't get anything back at his tax time because he'll have taken his credit already. Now you can choose to take the credit at tax time, and that means John would have to pay his full monthly premium every month, and then when he filed his taxes, he'd get $3,552 back in whenever, February, March, April of 2015, or quite a bit later. Now, I suppose there are some people that maybe would say, well, this could act like a Christmas club, and I'll pay the premium and then know that I'll get a big amount of money in April or March of the following year. But then again, you're using your money when you could be using somebody else's and keep your money in the bank. So that's why I say I can't believe anybody would pick not to have it advanced and wait till the tax time, but there may be some individuals that will want to do that. The next thing, and we all know this can happen, what happens when your estimated income for the year is different from the actual income. And people could get wage cuts, people could get wage increases, people could lose their job. So there's a lot of possibilities there. So the final credit is based on actual income. So when you file your income tax after December 31st, 2014, they will take that line of what your actual income is, and then they will find out what your tax credit is. It'll be reconciled at that time. So if your income increases during the year, you may have to pay some of that tax credit back. If your income decreases, you could get more tax credit. So it's sort of like when you go in and do your W-4 or W-9, whatever it is, where you elect how many dependents you have when you're working. And some people say, well, I'm married and have a spouse, but I'm not going to claim married and 2. I'm going to claim single and 0, so I make sure I get a refund at the end of the year, because I don't want to have a big tax liability when I file the taxes. So when people are estimating their income, they probably should estimate it a little low so they don't have to pay something back in the future. But you have that ability to estimate it however you want, and Andrea and I were just talking about the games people may play to get their premium lower and their tax credit higher, is they could actually go in when they're filling out the initial application, and maybe their income's $30,000 and they could put down on there it's only $27,000. And to my knowledge, there isn't any check on that initial application. There could be in the future, but you're just going to have to pay it at the end of the year.
Part of it will actually, it goes through a hub that is going to verify that what you're reporting now is close to what you had reported on your taxes the year before. So if you do a drastic reduction in what your annual household income is, you're going to have to provide documentation for that. They're not just going to give you that credit up front. If it is a drastic change, they're going to want to see that there's some type of documentation. A couple examples we had was a newly divorced couple. Well, together their combined income was considerably higher, but now that's an individual and may not have had a good paying job, or maybe had a higher paying job. So it's going to be providing that documentation, because they're not just going to take everybody's word for it if it's a drastic difference from what the previous year was.
So part of my question is if a person loses their job, I would assume that their previous employer would have the documentation that they're no longer employed. But what if a person is, say, living off of a retirement income where they take out a certain amount of money to live on, but then the next year they take out a reduced amount? How is that verified about their income being lower?
It's going to be, reporting that current income. And that's going to be, it can be scanned and attached to your, uploaded through the healthcare.gov, or you can actually submit it in paper copy and mail that in. But that's what they're going to use, and this is self-reported estimates of your income for the next year when you're filling out that initial application. But if it's drastically different, that's when they're going to want the documentation. And then again, it's your responsibility on the back end, because you're either going to pay that fine because you took that money up front you shouldn't have, or you'll get more of a tax credit because you didn't utilize it. And you can also select, it might tell you that you're eligible for that the monthly advance credit. If you go back to that previous page of $296, you might select to only use 200 of it. And that way you're not using the whole premium just in case your income changes. Then you're more guaranteeing that you won't have to pay that back afterwards. You can set whatever they tell you your premium tax credit would be, you can set it to the full amount or any variation from 0 to that full amount to help ensure your finances as you're getting to the end of your tax year. And you can adjust that throughout the year.
There is a safeguard if your income goes up. There is a cap on what you have to pay back, and you can see that on the last sheet. So if you underestimated your income, and based on what percent of the poverty level you're on. You can see the maximum somebody that's under 200% of the poverty level would have to pay back is $300 as a single taxpayer, and $600 as married filing jointly, and it goes up as your income goes up. If you're over 400% of the poverty level, it's full reconciliation, so whatever you didn't estimate, you'd have to pay it all back. If it goes down, you don't have to worry because you're going to get additional tax credits and you'll get more money back on your tax return. Yeah.
Now, this is only the marketplace. It can't be like your own individual insurance that you purchase.
All that will have to go through the marketplace. Matter of fact, we had somebody in Pickford where they told me that, I think it was Pickford, they said, well, I buy my own policy right now. And that day I had just given her the talk. About 2 days later, she wrote me an email and said, I'm glad I went to your talk because Blue Cross just said I can't buy my individual policy anymore. I have to go through the exchange. So everything will be going through the exchange, either Blue Cross's exchange, the Consumers Mutual Public Exchange, or one of the others. So anybody who's buying individual policy right now will get a letter from Blue Cross. They'll want to keep you in their product, but it'll be through the exchange instead of your
Do you
normal.
have to rewrite, do you have to go on the computer then and do all the filing?
Well, if you can get tax credits, you would want to.
Right.
Yeah, but you could just go through your local agent, whoever you bought it from, the Blue Cross online directly, because you can go online to Blue Cross now. You can go online with Consumers Mutual. You can go online with McLaren Health Plan. You can go online with Priority Health. All the different exchanges, and find out what the rates are going to be and what the coverages are. So that's what's so confusing about it, because there's so many choices.
Do you know if there's a mandate in part of the Affordable Care Act where there's no waiting periods, or like, say my husband changed jobs, which happened when we came to the Sioux, and we had a 6-month waiting period for his insurance through his employer. Are there waiting periods like that? And
I don't believe there is. Yeah. Now, there's also, when you change from one employer to another, there's COBRA coverage that you can buy from the previous employer. And that would be an option, but that's why I think they said in there, if you have a temporary gap in coverage,
3 months. Yeah.
3 months. But I don't know that they can have any more than a 3-month wait, because that happens a lot. People changing jobs, changing.
That, or what'll
coverage.
happen is because it's a loss of insurance, there'll be, that initial open enrollment is October 1st through March 31st. Then because they technically would have lost coverage, it'll be an exception, and you can go into the marketplace and fill out the application at that time.
Okay, but would you have to go to the marketplace and get temporary coverage if there was a 3-month waiting time?
If it's 3 months, you can gamble and hope that you don't have any medical expenses at that time, or you can go through the marketplace and purchase. And there wouldn't be a penalty if it's only 3 months.
Right.
Did I understand when you were saying you can go on Blue Cross and you can go on these various insurance websites right now?
Right.
If you didn't want to go, would that be a substitute for going through the marketplace? You could purchase your policy directly from them right now, so she could go right back to Blue Cross Blue Shield or talk to her agent and get signed up right now for it to kick in with the Affordable Health Care Act.
Right, but
So
you
she
would,
wouldn't have to do that.
yeah, but you would, if you're gonna get tax credits.
You cannot
Only
get
to
tax
get the
credits.
tax credit,
Right.
okay.
If you want tax credits, you gotta go through the marketplace or the exchange. Yes.
Does that, will that affect the Medicare, Medicaid system? Like if there's so much tax credits, will there be a bust later on, do you think?
Well, that's a question I had on a lot of the forums, who's gonna pay for it, you know?
Right.
And, you know, we all are paying for it. As citizens, tax-paying citizens, we will all pay for it. And right now, employers are paying for it because they're getting hit with additional taxes. But eventually, you know, depending which pundit you listen to, whether it's going to be sustainable or not, you know, and I don't really care what side somebody's on. The fact of the matter is, if it's costing more money than it's bringing in, taxes are going to have to increase. You know, when will that happen? Will it happen after a year? Will it happen after 2 years? Will it happen after 5 years? Who knows? But somebody has to pay for it. The other end is, you know, the reason the Affordable Care Act was put into place, some of the reasons were coverage for all. Well, everybody had coverage before, because hospitals cannot turn away anybody from the emergency room. Okay, now you may not
I
have,
don't buy.
what's that?
That argument, it holds no water.
There's a law that we can't.
Well, I understand that,
Yeah.
but emergency care for a cancer patient, try it.
No,
Yeah, well, what I'm saying,
Let me,
now he
let
doesn't
me,
have cancer.
let me
so-
finish. Let me
Yeah,
finish.
well-
Okay? I said emergency care, everybody has emergency care covered. If you're looking at preventative care or continuing care, that was a different story. You couldn't get into a doctor's office. Nobody would treat you potentially without insurance. But at the same time, all hospitals in Michigan until the last 2 years are not-for-profit hospitals. Therefore, we have to give away so much free care. Last year at War Memorial, we gave over $2 million worth of free care away. And it's to those people that don't have insurance and need cancer treatment or other things, and have income that's below. So, and then, you know, on the other end, I see what's going to happen is that currently health insurance is a defined benefit system. Your employer pays in money, you get a defined benefit for that money that they pay in. Because of the health insurance exchanges and the choices that are out there, I think it's going to turn into a defined contribution plan. So if you're employed, this doesn't deal with Medicaid or Medicare or any of the other, but if you're employed, I see a lot of employers saying, here's X amount of dollars, you go to the exchange and buy your own health insurance, you can pick whatever plan you want, you don't have to be part of a group plan anymore, you can pick one that covers 60% or 80% or 90%, and if your plan doesn't cost you as much as what the contribution is from your employer, then you get to keep the difference. From the employer's perspective, there's a benefit because you get a fixed cost from now until whenever. It doesn't go up 20%, 40% a year. But what does that do then to the bad debts percentage at hospitals and doctors' offices? Because if you choose a 60% plan and you have to pay the 40%, the last person people pay when they owe money is a hospital. The second to last person is a specialty physician. And the first person they'll pay is their primary care physician because they know how to keep going back to their primary care and they have a relationship and whatever. But if you're a patient of a family practice doc and he refers you to the cardiologist and you go see them one time, if you can't afford paying that 40% to the cardiologist, you're probably not going to pay it. So I see bad debts going up substantially. And then the whole cycle starts again. You know, we as hospitals have always shifted costs to employers and people paying for private insurance to cover what we don't get in from the uninsured. And so that's why the costs continue to go up. This is trying to eliminate that, but if bad debts go up, are we going to still have that cost shift? You know, time will tell.
We are already covered through an employer. We don't need to do
No.
anything at the marketplace. How do
No.
they know that we're covered and we don't pay a penalty? Is that through our taxes or?
Your employer is going to have to report
Yeah.
on your W-2 at the end of the year
Okay.
that you have
And then
coverage through.
uneligible for subsidies because we are getting a benefit
Correct.
through our
Right,
employer.
right. Now the caveat there is, you know, if you're in an employer who offers health insurance, but you're in that one of the categories of the federal poverty level, when you get employer-sponsored health insurance, you don't qualify for tax credits. So let's say most employers are going to high deductible health plans, like at the hospital now, our deductible is $2,000, $4,000. Well, if you, because of your income, maybe you're one of the lower paying jobs in the hospital, and maybe you're making $25,000 a year or $30,000 a year, and you'd be eligible as a family of 2 or 4 for $10,000 in tax credits. You can't get those tax credits that might lower your out-of-pocket to below the $2,000 or $4,000 deductible you have because you have employer-sponsored health care.
So you can't opt out of your employer to get a better coverage through the marketplace?
No, not at this time. You don't get that choice. That's why I think a lot of employers will say, let's go to this defined contribution. We're going to give you X amount of dollars to go out on the marketplace and buy health insurance, and then you can make your choice. Now, the next part we wanted to have Andrea talk about how you go through and find out all this information because it's very confusing, and she will talk to you about how CHAC is being certified as navigators and what they can do to help you through this process.
We've all heard about healthcare.gov for the marketplace. The challenge is that there are a number of glitches on the website. So if you have personally taken the initiative to go to healthcare.gov to start an application, it's a flip of a coin. You might be able to get through the entire process very quickly and smoothly, and, as David did, and find out what your premiums, your cost share premium tax credits would be, what your cost share eligibility would be, and what plan options would be available. Or you could be like some of the unlucky ones, and that includes us navigators, where we're just stuck. It's just kind of cycling through. Right now, they're anticipating that all glitches should be worked out by mid-November. So that takes a month and a half out of that initial open enrollment process for the website. However, you can do a paper application. You can call there's a handout out back that does have the 800 number that you can call, and they will actually take your information, start an account, and get that process started. However, when you go in, you'll enter your information as we were talking about earlier. You're going to give your anticipated income for the next year. So again, it's not exact. It's, as you mentioned, you're anticipating that it'll be a lower amount. If it's a drastic difference, you're going to have to provide that documentation before they're going to let you know what your premium tax credits are, what your cost share discounts will be. And sorry, kind of a little over the place. There are actually some states that have not expanded Medicaid, and with Michigan, the expansion goes into effect April 1st. So that January through March, you have individuals that may or may not qualify for Medicaid if they're on that border. They're actually encouraged to go through the marketplace as well, through healthcare.gov, and fill out that initial application, which will refer the individual's information to DHS to make a determination for Medicaid eligibility. Because if you qualify for Medicaid, then you're not eligible to purchase through the exchange. The benefit of also going through healthcare.gov to do that application is that if ultimately you're denied Medicaid because you don't meet guidelines, then you get that special enrollment period, because it'll be after the March 31st, you'll be able to still do that application without facing a penalty of not having insurance for the full year. In subsequent years, the open enrollment period will be, it's like October 1st or 6th through through November 16th, I think. So it's a much shorter window for those subsequent enrollment periods into the future. And individuals can start doing that Medicaid application through healthcare.gov beginning January. What they'll get is like a pending status, and then that information will be transferred over. As David mentioned, there are the different metal tiers or plans, and right now there's actually only 2 or 3 policies in the Upper Peninsula that offer a platinum plan. We don't have a platinum plan for Chippewa County. There's not one for Luce County. I think there's one platinum plan in Mackinac County, or one exchange that's offering a platinum plan. And that's really, again, they're looking at, what are the expenses going to be for the exchanges, the Consumers Mutual for Michigan, they're a nonprofit. So all of their funds will be going back into lowering their plan prices and offering additional preventative services. So, this being so brand new, a lot of the exchanges are leery of offering that platinum plan, not really knowing what those coverages are going to be. Yes.
When you talk about these coverage areas, is that based on where the person's residence is, or where they're seeking coverage?
It's their residence. When you sign up for the marketplace, it's going to give you, as I mentioned, in Chippewa County, there's Blue Cross and Michigan Consumers for Healthcare. Priority Health is not in our region. So there's those 2 companies that are offering coverage currently. There could be additional ones if they're approved to enter the exchange. And there's a couple silver plans offered by Consumers Mutual, but like I said, a couple silver plans, but not a platinum plan. And again, it is broken out by that geographical region because the prices can be a little bit different based off of where you reside, because again, different insurances and services are available.
So do
within
those
those
plans
communities.
allow you to seek care? Like, so often I feel like people come into War Memorial and then require maybe more acute care, and there's that choice of Marquette or Petoskey. Could you
You're gonna have
get
an
coverage
in-network,
here?
you're gonna have an in-network deductibles and copays, and you're gonna have an out-of-network. So you will still have those options and you can still choose, you're just gonna pay a higher rate for those out-of-network services.
And are in-network services all in the UP?
It'll,
No, Blue Cross in-network is the state of Michigan.
Okay, okay.
Consumers Mutual has contract with all UP hospitals, has a contract with McLaren, but doesn't have a contract with, say, I'm not sure, but say University of Michigan. Okay, so with some of the companies, you know, when you're signing up, you're gonna have to make sure that, you know, they all have to have a minimum amount of coverage throughout the state. So in let's say Grand Rapids, where there's 6 or 8 or 10 hospitals, they have to have somebody under contract. So if you were used to going to Spectrum, but Spectrum didn't sign up with that particular insurance company, you would have to go to the company within your network within Grand Rapids in order for you to have the in-network deductible. If you went to a different one, you could still choose to do it, but your deductible would be higher. So that's the confusing piece. At least in the UP, with Blue Cross and Consumers Mutual, you know that every hospital in the UP is covered. But you don't know if every physician is covered. And so that's the research that has to be done, which hopefully when the navigator helps sign up for a plan, you can ask those questions, because it is a big question.
That's why I wondered, how
Yeah.
so often over the years, that stuff is not so readily available when you're making a purchase, and it's, once you start taking advantage of the insurance, you realize, oh, you know.
Yeah, what did I choose?
What happens if you go on vacation and something happens and you're down in Florida or something like?
you're gonna pay an out-of-network.
You just pay out of network thing?
Do you have any idea what those ratios are?
I know that there's a maximum that you can, out of pocket, you can pay in a year. And that's, I think, $6,800 for an individual and $13,500 for a family.
Regardless of in or out of network?
Right, that would be the, you know, what the max you would have. If you're in network, I think that same amount might, yeah, regardless of whether you're in or out of network. So, you know, if you're on a silver plan and you have to pay 30,000 or 30%, and you have open heart surgery, say it's, you know, $50,000, that would be cheap for open heart surgery. But if it was $50,000, you'd have to pay $15,000 of it. But if you were a single person, the max you'd have to pay is $6,800. And if you were a family, the max you'd have to pay is $13,500. So, because that 30% or 40% or 20% could very easily get over, you know, a pretty high amount of money. So that's why they put those caps on it.
That's something you don't hear.
Well, if the caps are in place, then what's the point of a percentage of deductible being there? If it kind of counteracts one another.
In a way, but for most people, I'm sure they've done the studies, most people don't incur that much expense during the year, you know, only if you have a catastrophic event that happens. So, you know, if you take a normal person, maybe they have, you know, $10,000 worth of expenses in a year, and that might even be high. But, you know, then the difference there is, okay, you want to pay 30% of it? If you do, then you'll get a cheaper rate. If you don't want to take that risk and only want to pay 10%, then you're going to have to pay more in the premium, and that's that balancing thing. You know, nobody knows when they're going to get sick. I mean, if we could predict it, then we could buy the platinum plan this year because we're going to get sick, and we can buy the bronze plan next year because we're not going to be sick. But you know, it's too hard to predict, and you know, I think they did it just to give people a choice. But there is that cap on, because that was my question to begin with. I mean, you know, some people, they get into, you know, have a tragic automobile accident and have to get rehab for, you know, a year afterwards or 2 years afterwards, and might rack up $1 million worth of costs. How is anybody ever going to afford $300,000 for a copay? And so I'm sure that's why they put the cap on there, so that, you know, you wouldn't be at risk for that.
Interesting point though, Ron, because if you take that cap and then you take those different 10% in between, you're really not talking about that much difference in how much money you could be laying out in a year.
Right.
Very interesting.
And then you have to wonder about who's going to make up that, what was it, $875,000? It's interesting.
What, again, because we really can't get into the marketplace to actually walk clients through at this point, what has been explained to us through our trainings is that once you have submitted your information, you find out what your premium tax credits are, your cost share, then you'll have your prices broken down for the bronze plan, silver, gold. You're going to then be able to select which level options you want to look at, and also by insurance company. We were able to look at a couple of the plans through Consumers Mutual a couple months back, and within their plans, they actually had some diagnoses that they would provide 4 visits. So if you were diabetic, you could have 4 diabetic office visits at 100%. You could have certain diabetic medications that were for $1 or $2 copay. And that's built in within their plan, above those minimum essential benefits, which covered those so many preventative exams for the year. So you go in for your annual visit with your provider. Then if you go in for your next visit and they code it as diabetic, that visit ends up at no cost to you as a patient. You go for your second, your third, and your fourth, and as long as they use your diagnosis as your diabetic diagnosis, none of those, there wouldn't be a copay for those visits. Then I believe hypertension was another diagnosis. So again, that would be 4 visits under that diagnosis that you could have covered as, you know, for your care. So that again is looking at what are your individual needs and being able to look at what the policy covers. What we're anticipating is that individuals are going to come in, do that first initial part, getting, you know, to what are my premium tax credits, what are my cost share, and then look at the different plans, take those home, study them, read them, come up with your questions, and then coming back to select which policy. You know, there's going to be numbers from those policies that you can contact those insurance companies directly to ask very specific questions as to certain coverages within the area, and then can finish the enrollment after. Yes.
But it seems like with these exchanges, there's only 3 basic plans in the UP that people really have to concern themselves with. I think back to when Medicare Part D was passed. And the seniors were asked to choose amongst drug plans, and there were 50 of them. I mean, it was insane. That makes this, if you put it all into perspective, it makes this relatively simple. The fewer
Aside from the fact that
plans
you
there
can't
are.
choose the 2 higher options.
I'm sorry?
Aside from the fact that we can't choose the 2 higher options based on geography.
There's
Right.
not a, yeah.
Not platinum.
That's what I mean. I mean, you don't have to
In this first
pour
year.
through 50 plans to compare with the drive. And, you know, at least you still have your marbles together. When you talk about people over 65, they were confronted with this. They
That's
didn't
debatable,
need a
sir.
navigator. They needed a seeing eye dog to get through that debacle. And it really didn't do a whole lot except sell more drugs to people, ultimately.
I was gonna go and make sure that Jack also helps people with their Medicaid and Medicare. I mean, that's part of what you guys do also, isn't it?
We don't do anything with Medicare. Once an individual turns 65, they'll do that enrollment. They have 3 months prior to that they can start the enrollment process for Medicare. We do assist individuals with the Medicaid application through the MyBridges website currently. And again, as January 1 comes, we'll be doing everything through healthcare.gov because it's going to make that referral and that preliminary determination to let them know if it'll be Medicaid or through the
But then you
insurance
will help
exchange.
them understand what Medicaid and part of that also.
Yes,
right?
yep,
You go to you.
yes.
The timeframe for the open enrollment you were talking about that runs October to November, if someone is not sure if they're going to get Medicaid and they've been sort of sitting on it while all of this filters down, is that something that's better to do during that open enrollment?
That time frame is for the following year, next year.
Okay,
So right now, it's October 1 through March 31st for this initial enrollment period. Goes all the way through March 31st.
Oh, okay.
However, if you wait till March 31st to sign up and you pick a plan, you won't have coverage until May 1st.
Yeah. So would it be useful for them to go through the Medicaid application first, or?
Actually, come January 1, the guidelines for Medicaid are going to change. Before, you had to be pregnant, blind, disabled, or a caretaker and be within a certain income guideline. Now it's strictly based off of income, and they do a monthly income, whereas the exchange is your annual household income. So you will still have to provide monthly documentation for DHS, but that's going to go, it's kind of contradictory where you look, but it states either 133% of the federal poverty level or 138% of the federal poverty level. Plus, they have calculations for deciding, you know, they can make adjustments to the income, and, you know, earned income versus unearned income counts at different levels. So they will still have their calculators, you know, and formulas that they have to use for making that final Medicaid determination. Which again is why you want to go through healthcare.gov, because if you are declined, you still have the option to enroll through the exchange for insurance to avoid a penalty.
So wait till after January 1st?
Yes, because that's when they will be calculating off of the new guidelines.
I have a question. Okay, so you're saying like you want to find out who's insured at your workplace first, right?
Who is being provided insurance by their employer?
By your employer.
Right, so if you were working part-time, like I am,
Right.
at both my employers, I work 2 jobs, how does that?
If they offer to full-time employees, but you don't qualify,
Right.
you are eligible for the exchange.
Through the exchange.
Because you aren't, even though your employer is offering insurance, they aren't offering it to you.
Okay, that's what.
Right. Yeah.
And there's actually a form that if your employer does offer insurance right now, but they're talking about maybe we're not going to continue it after January 1 because, you know, the employees can get a better rate going through the exchange, then there's actually a form you can bring to your employer that has them fill out whether or not their insurance policy meets the guidelines to be considered a qualified health plan.
And there's a lot of businesses these days. Like my daughter works for UPS. UPS is a big company, and they've told all their employees we're no longer covering spouses. We're going to cover the employee and the children, but if you're a spouse of the employee, you have to go to the exchange or go find your insurance someplace else.
Because those are ways for them to lower the rates for their insurance plan, and the individual can then purchase, or that individual may have chosen to decline their employer-sponsored plan and could pursue that through the employer.
If they have 50 employees, don't they have to?
That was delayed until January 1st, 2015.
That's right.
Yeah.
Okay.
So it could shake things up a little bit again if that does go into effect January 1st of 15, because then you have to find out, does that employer have a qualified health plan, and if not, then the individuals may have to pursue the marketplace, or they may drop their individual plan through the marketplace and be through that employer plan.
And I think the reason they delayed it was there's plenty of employees working part-time and work between 30 and 40 hours a week, and the employers keep them under 40 so that they don't have to offer health insurance. Well, if that would have gone through, then you would have seen a lot of these same employers say, okay, I can't work at 32 or 36 hours a week now, I can only work at 29 because I can't afford health insurance. And there was a lot of pushback to the federal government by employers that said we're not going to be able to afford to do this, so they delayed it a year. But you're right, originally it was supposed to start January 1st.
Okay. So, could the employer, if they have the 50 people or more, could they just offer like not a very good plan and then say, why don't you, hint, hint, go to the federal, go to the exchange instead? Could you drop their employer's plan and go?
You have to provide a plan that provides the minimal essential benefit.
Okay.
So what they've done is they've set a floor that every health insurance plan in the U.S. offered by employers has to meet these standards.
And the insurance companies can't sell them something below that.
Right.
Moving forward.
But that's what I'm saying, there's probably going to be a number of employers, I would think, that would say, okay, in lieu of us paying for your health insurance, here's X $1,000. We're offering you that money stipend instead of health insurance. Now you have a place to go and get it on the exchange. Because before, the reason everybody was covered with group life or group health insurance was the cost for a group was so much lower than trying to go to Blue Cross or any other insurance company and buying an individual policy. With the exchanges now, that doesn't hold anymore because the price is based on a statewide exchange rate, not a group rate. So, I do see, they say you don't want to be the first, but you want to be a fast second offering that. And truly, you don't get taxed on that extra income because it's being used in lieu of health insurance. But if you did, let's say, I think the cost of a single plan for our employees is like, for one person is like $600 a month, so it's that $7,200 a year. And let's say we offered each employee that's one person covered $7,000, and you go to the exchange, and maybe you buy the bronze plan that only costs $5,000. Well, you wouldn't be taxed on that $5,000, but the difference between what we paid you and what the plan cost you would be taxed on. But it's still more money in your own pocket. But then what risk are you taking, because now you have a 30 or 40% copay, and that's what's really going to be confusing to a lot of people because they don't understand the coverages and what's out there. I would say anybody that has a chronic condition, high blood pressure, high cholesterol, diabetes, congestive heart failure, things like that, when you go in to sign up for the exchange, you need to make sure you ask those questions and say, okay, I want to make sure this is covered, because as Andrea said, Consumers Mutual has probably 100 different silver plans with 100 different coverages. They may not offer them in all the areas, but one silver plan might cover the 4 visits for free if you have diabetes, or the other one wouldn't. And so it's really going to be confusing for the average citizen to determine what's the best coverage for me and what should I be
And David,
paying.
just to ask a clarifying question, you're saying that employers may offer that $7,000 in lieu
Right.
of, but that's only for large employers.
Right.
Over that 50, that's only until that mandate goes into effect that you would have to offer insurance if you
Mhm.
have over 50 employees.
Right.
So that could
Change.
almost be taken off the table as an option.
Right.
If that if the mandate really stays in effect to go in for January 1 of 15. But there's so much, like you said at the very beginning, we say this today, and it could honestly change tomorrow.
So do you think large businesses have an incentive then to bring their employment down to 50 or fewer? Because
I don't
like
know that they-
for instance, my dad, he's got 64 people employed for him, and his insurance company has told him, you need to get 14 people off the books because it's going to be way too expensive for you. So
And it's full-time equivalent.
Right.
So that's something you have to keep in mind too, that, if there are
A bunch of part-time.
a bunch of
people.
part-time, that may not equate to 50 full-time.
But it's true, if that mandate goes in,
yeah.
then if you're in that gray zone around 50 employees, you have to make that decision. One over here.
All right, you're talking about group rate plans, right, for a large employer?
Right.
Okay. Would this everybody required to buy health insurance, shouldn't them group rates actually go down?
Well, you would think so, but that's not how the market's working, because there's the extra tax that you have to pay to help offset the cost of the Affordable Care Act. And that, like I said, in our case, is about $500,000 a year, and there's some plans that don't offer the minimal essential benefits, so when you add coverages, your premium's gonna
But
go
I mean, the
up.
thing hasn't really started yet either.
Right, right.
I mean, once the thing gets moving and, because I mean, an insurance company can only use so much of what they bring in for, profit.
Right, right.
I mean, everything else, they go over that, they've gotta send a rebate back to either the employer or to the individual.
That or they have to invest it into the plans to offer better coverage moving forward.
Right, so what I'm saying is, I mean, some of these arguments are not based on facts, they're based on projections
Right.
and the
Oh, yeah.
circumstances on the ground as we see it now.
Right, right.
Okay.
Yeah, it seemed like if companies, or, yeah, if some companies so far have seen rates go up, like the competition's not all in place yet. Like, I haven't looked for insurance yet.
Right. Right.
So it's not very realistic. Another point that I wanted to make in talking about the potential for the hospital to have bad debt is if there's a cap on the amount that individuals and families can pay out in co-pays, then there's going to be a cap on your potential for bad debt for each of those families.
True,
Yeah.
true.
Covered by taxes.
Yeah,
Yes.
right.
Covered by, you'll pay for it in the end, Joe.
Covered by the
Well,
policy.
everybody's gotta pay for health care. I mean, whether you're a group.
Do we really want to turn this into a constitutional argument, sir?
Well, I'm just saying, it's like, you bring politics in to
No, I
drive
simply,
the argument one way or the other.
I
I mean,
simply stated we're going to pay for it. It's that.
Well, we're
cap
paying for
on-
it now.
The cap on debt is not going to be evaporating.
well, I mean, you're paying for it now, whether the plan's in it or not. I mean, whatever plan you use. The old system, new system,
We have a couple questions
think
over
bigger
here.
system.
Nicole?
Well, I have a question. Like say if I'm on the marketplace and the computer and, you know, sometimes I feel uncomfortable giving my information out. I mean, I'm just,
Go ahead.
I was raised. Okay, well, like right now I have health insurance, but to take the health insurance, like to go to the marketplace, do I have to cancel out that health insurance that I have? Like out of the phone? Or who do
You
I-
purchase health insurance right now? An
Yes.
Individual?
Yes.
So whoever you're purchasing it from should be sending you information that you can't have the same plan you have now, so for
They
the
did, but they
future.
said that they weren't gonna be through the marketplace or something like that.
And they could, but you should check with them, check with the marketplace. And you're right, the information they ask on that, you know, government website, they want your name, they want your address, they want your social security number, they want your birth date. And you know, when I was going on it just to see what the rates would be, I felt a little uncomfortable saying, was this actually the government website? And you know, if it wasn't, you know, how many people are out there maybe copying the government website just to get your personal information, you know? You don't have to give a credit card or anything, but when you're giving social security and a birth date, that's a lot of
Big thing
information.
to keep in
So
mind
if
is
you need help, do you
Yes.
go to?
you come to an organization that's certified. Okay, you're gonna have navigators who have gone through 20 plus hours of training, completed their testing to become certified. For our area, that would be our organization. You're gonna have certified application counselors who have completed training, not as much training, but they have completed maybe 6 to 10 hours of training. And we've all passed our background checks. We have policies in place to secure information. We are not allowed to keep your information unless you sign a release saying that you authorize us to keep personal identifiable information. And we don't guide you as to what policies you're gonna pick. You have to pick it. We can review them with you, we can answer as many questions as possible, but we can't say, pick this plan, or I suggest this plan. Be very leery if somebody says that there's a fee for enrollment. As a certified application counselor or navigator, you cannot charge anything for assistance. You do have insurance agents and brokers who have completed their training for the marketplace, and some are signing up to actually enroll people through the marketplace, others are not. So again, you can check with your insurance agent. They may or may not charge you for that because, again, that's their options. As certified navigation counselors and navigators, we don't. And always be leery of what computer you're using. You know, are you going to an HTTPS site? That S is secured. Always make sure you go to healthcare.gov. You know, don't go to another one that says they're working with. You always want to go to the healthcare.gov site.
Okay, but like, so what I have to do would probably be
Call
drop
our-
my insurance and then go to the health?
I would say no, because your coverage isn't going to go into effect until you've paid your premium. You'll go through the whole process. You'll pick your plan. You will get communication from that insurance company you chose that tells you you must pay this premium by this date to have coverage by this date. You have to pay that premium before your coverage will go into effect. So you don't want to drop your coverage now for something that's going to not go into effect for 3 months. Because then you're putting yourself at a point where you're uninsured.
My suggestion would be go into check with your information and then.
Call and schedule an appointment.
Yeah, schedule.
Carry
yeah,
all your
sch-
stuff around.
Schedule an
because, again,
appointment and then the navigators there can help you through the process and make you feel a little more comfortable.
And also to put that caveat out there again, there are a lot of glitches with the website. We are not scheduling appointments until late November because that's when they're anticipating the glitches will be worked through. I mean, to have you come in and we would be, you know, we could go to, there was the one the link in David's presentation for the Kaiser Foundation, so you can kind of look at what some of the subsidies what you could qualify for. It'll give you rough estimates. It's not going to be exact, but it'll give you some information, and they're close. I mean, they give you some very accurate information, so that you can kind of start thinking. And on the back of the one handout that has our business card stapled to it, because we do have offices here in Sault Ste. Marie, one in Newbury and one in St. Ignace, it does tell you, you know, things you need to prepare. So things that you'll need to bring in, because you do. I mean, you need to know the employer, if you have the employer's identification number, because again, this is going to link back to, does that employer offer insurance? If it does, you don't qualify for a plan here. So, sorry, one up here.
If you're moving, how's that going to work? So, for example, if your residence is currently in Pennsylvania, but you know you're moving to Michigan in the near future, but not quite yet, how would you work that as far as choosing a marketplace? Because they're different by state and residence. But if you don't know where your residence is going to be yet, and then
You are going to want to apply where you're at currently to make sure you have coverage now. And then when you do move and you have that location, you will have like an exemption period for enrollment. So if it's after March 31st, say you move April 15th, you will have, I don't know if it's 30 days or 60 days after you move to, for your exemption period to enroll into the exchange here in Michigan.
And all the premiums you paid in your former residence carry over into a new plan?
Not the premium, the tax credit.
The tax
Because
credit.
the tax credit.
But any part of the premium you paid out of pocket won't carry over.
You would be
Oh, it
paying
would.
premiums for the months that you were there, that you
there.
had coverage, but then you're going to be starting a
But
new
the-
policy with new
Right.
premiums.
But the rates in Pennsylvania for the silver plan might be different than the rates in
Okay.
Michigan. So
So-
if Michigan rates are higher, you get the same tax credit based on your income. That's going to stay
Yeah, that's
consistent
federal,
between
that's
state and
across.
state, state. But you could end up paying,
More out of pocket.
More or less.
more or less, depending on what the rates are.
Okay, thank you.
Is there any provision for a carryover of that deductible plan?
I'm not sure of that. You know, I think if you're paying I would think that the cap would be no matter what state you're in. You know, if you paid $3,000 in your deductible in Pennsylvania and then you came to Michigan and paid another $4,000, that $6,800 cap would be cumulative. You wouldn't have to start over
That's a
again.
federal mandate.
Because that's
Yeah,
a federal mandate. But I'm not sure how that's going to work. That's one of the questions that's still out there.
And real quick, you had said that the Consumers Mutual was created in order to create competition in the marketplace. Who was it created by and where are they based out of?
The federal government, when the Affordable Care Act went into place, had a pool of money that any state could set up a public exchange. And I believe the state of Michigan went through and said, well, and Consumers Mutual is a not-for-profit, but it's not owned by the state of Michigan. They found some people, and I think Janet Olszewski, who used to be the director of the Michigan Department of Community Health, got a group together and said, let's apply for this money to start Michigan Consumers Insurance, Michigan Consumers Mutual Insurance, or Consumers Mutual Insurance in Michigan. It's very confusing. And so they applied. The federal government looked at all the applications from the state of Michigan. They might have been the only one, so they said, okay, we're gonna grant you this money, this $90 million to.
And that's a loan, correct?
And that's a loan.
That's a loan.
It's a loan, they have to pay back. So it's like, I always try to compare it to, you know, you have the banking industry and you have a regular bank and you have a co-op. And, you know, the co-ops are owned by members. And any money they make goes back into services or reduced interest rates or whatever. You know, nobody takes a profit out of it. Where banks are for profit, and when they make money, it goes to stockholders and pays dividends or whatever. So Consumers Mutual is a co-op, so all the premium will come in. If they have a profit at the end of the year, that money will stay within the company to reduce rates or provide expanded coverage. And all the members who are buying insurance through Consumers Mutual are the owners of Consumers Mutual. So it's like a co-op in a bank. And this was an option. Some states took advantage of it, some states didn't. I think Michigan did, for the mere fact that Blue Cross was such a dominant player in the health insurance market that nobody else could come in and compete with them. So how are you going to get lower rates if there's no competition?
And they're based out of where again?
Lansing. And they have a website, and they have a lot of advertising going on in the southern part of the state, but I haven't seen anything up here yet.
There is a UP regional manager that I've worked with, and he did the presentation earlier this year that gave us some of the, so many X number of preventative care visits under the diagnosis. So there is a regional rep.
And I think his office is in Iron Mountain, isn't it?
Yes.
Do they have a listing of the physicians that are in that plan?
I believe they do. And they should have a listing of the hospitals that are under contract. And they have
all the contracted hospitals were in the UP, so.
Yeah, all the ones in the UP I know are, because, you know, the hospitals in the UP are all members of what's called the UP Health Plan, which is the Medicaid HMO. And Consumers Mutual went to the UP Health Plan and said, we want to contract with all the hospitals. Can we do it under the UP Health Plan model? So I know in the UP we're all.
There was some question, and maybe you can clarify, in Escanaba, which is the hospital.
St. Francis in Escanaba.
Because they're not actually
A part of the UP
part of
Health
the
Plan,
UP
but I
Health
think
Plan.
I think they signed a separate contract.
Okay. So, because that was one of the counties that was only listing Blue Cross
Right.
as a plan option.
Now,
But
Consumers
now-
Mutual continues to go out and look for other hospitals and physicians, but, you know, it's a negotiation thing. I mean, you know, they come and they say, okay, we're willing to pay you this amount of your charges. And each hospital then has to determine, is that adequate to survive or not? And some hospitals think it is, some hospitals think it isn't, and so then they continue to negotiate, and hopefully at some point they have a broader network, but right now they have, the federal government requires you have to have your whole area covered, have to have hospitals under contract, have to have physicians under contract. I guess they call it essential services or something like that. But I can tell you with Blue Cross, they do have a network set up throughout the state. Consumers Mutual is still developing it, but in each area they have at least enough hospitals and providers to provide the care for their insured.
And there's also a Blue Cross Blues or something?
Bloom, I think it's called.
And I've seen that they're popping up in some of the counties. They
Right.
haven't signed contracts with enough partners in that area to have those essential covered services. So that will become another option
Right.
that, and I'm not sure if there's even a deadline.
Yeah, you
so
can
you
file
can have-
to additional areas for coverage in the future as an insurance company.
Yeah. So then they're kind of losing out on the market share, basically, at this point, because they don't have an established plan.
No, you know, because we live in the UP and because the population base is only 300,000 and these insurance companies could get way over 300,000 just in one city downstate, we get less choices. You know, the Medicaid HMO, there was no other state HMO that wanted to come to the UP and be the Medicaid HMO. That's why we created the UP Health Plan. And so we do get a disadvantage because we don't have a lot of population, and a lot of these insurance companies want to sign up a lot of people so their risk is less, because if you have a smaller group and you have usage that's high, you're going to lose money, where if you have a larger group, you can sustain that over that larger group.
There's
So
more premiums coming in,
Right.
so that can be used
Right.
to pay out.
So we are at a disadvantage in our choices.
They didn't write any type of subsidization on that, just because of the geographic, the population density?
They wrote that you can't charge higher premiums based in geographic
But
areas.
they didn't supply any extra, I mean, because you take, I understand your
Right.
idea, like
Right.
you go to New York City, I
Right.
mean, there's more people in 3 square blocks than there are,
Yeah.
you know.
Right.
But I
No,
mean, with
there's
the
not
vast expanse of the
additional-
United States, I mean, you
Right.
get into out west, I mean,
Oh, yeah, it's,
you take the whole state of Wyoming, for
Yeah.
instance.
yeah,
At this point, there are not additional subsidies because we live
right.
So
in a
basically,
small
that's a
geographical
quirk that's probably gonna have to be worked out down the road.
Yeah,
Once it's function.
right, yeah.
I mean, imagine they're probably gonna run into all kinds of things like that.
There'll be plenty of opportunities
Plenty of,
for improvement as the process grows. You know,
All right.
I keep saying this is not the end-all be-all solution. You know, I mean, there's a lot of people that are very adamant that this is awesome, this is great, and then there's others that are so completely against
I
it.
know.
And again, you know, coming in, it's, you know, we're not for or against any of the options, but this is an option. You know, we look at the communities and, you know, for the individual plans, for somebody who's just trying to purchase a policy, there are very few options, astronomical premiums. And that's not affordable. So there are so many people that just don't have an option. This at least gives the subsidy, brings it down, and is a step in towards a solution, and we can make improvements as we move forward. Yes.
Let's check the navigator, or the certified application counselors, is that where you want us to send that? That's where anyone can go, like all the
Yes.
students I work with, I should direct them off to
Mhm.
the check?
Yes.
Okay.
And just, again, you know, definitely have them call us, and just kind of keeping in mind that because of the glitches, I mean, it's in the news all the time, you know, with the glitches to the website, that, you know, there are delays, and we won't be scheduling anything till a little bit later, but definitely people can call, and that's what we'll be telling them, is that, you know, we want them to call us back, but we don't want to waste their time and have them come in and not be able to provide them with
And
the
ju-
services.
and just so you know, you have to, not a lot of people have probably read through the fine print, but you have to sign up by December 15th to have coverage January 1st.
For January 1st. Also, you keep hearing that open enrollment is until March 31st. There is some discussion and, I'm drawing a blank, legislation that's in place to try to correlate the dates, because if you don't enroll before March 15th, if you enroll by March 15th, your coverage will begin
May 1st.
April 1st. If you do it by the
April 1st.
15th, it'll start April 1st. So
Right.
you will only have 3 months of no coverage, so you'll fall under that exemption for those 3 months. But if you enroll from March 16th through the 31st, your coverage doesn't start till May 1st. So you will have an extra month of not having coverage, and you'll have to pay the tax penalty. It will be prorated to only a month, but you will have to pay a portion of that tax penalty. So they're working on legislation to align those dates because, again, it's probably just overlooked. You know, you have to give time for that premium to be paid and the policy to go into effect.
I was just gonna, no, is your office open to like setting up an appointment?
We really haven't scheduled any appointments at this point because, you know, again,
You wanna wait till-
we want to wait until, you know, we have a date. We could start scheduling appointments for, you know, after the 15th. They're hoping by the 15th of November, but then we may be calling you to say, I'm sorry, we need to reschedule this because.
But you'll put out a notice in the
Yeah.
paper or the press
We will
or
be
the radio
doing,
or
yeah, we will
whatever.
be doing much more advertising, please, you know, to call and schedule appointments. I personally cannot just call you and say, oh, well, so-and-so was at this meeting, so I'm gonna call and have them, you know, come enroll. We cannot solicit anybody to come enroll into the exchange. It's part of our contracts. We cannot call you. You have to initiate contacting us. Then, obviously by you giving us your phone number to call you back, we can then do follow-up with you. But we ourselves cannot
So,
come seek you guys.
so what if they called you tomorrow and said, I'm interested in coming in? Then even though you're not scheduling an appointment, because they made contact with you, you could put them on a list to call
We
them
could start
back?
doing a waiting list. The challenge, of course, is please don't change your number. It's amazing how quickly everybody's numbers change, but yes.
So how many navigators do you have in the Sue Chack office, and how many clients per day are you targeting to process?
The health, I'm drawing a blank, the health and,
HHS?
yes.
Health and
HHS.
Human Services?
Health and Human Services. Originally, the plan was that each navigator was going to get, there would be a reimbursement mechanism for every successful application, there'd be a $25 reimbursement. Health and Human Services said, nope, that's not allowed. You need to do a per organization sub-grant for the funding. So our organization was selected, but we were supposed to elect one person to be the navigator. So technically, for the entire Upper Peninsula, Region 1, there are 3 navigators. Myself, a lady out of Marquette County, and a lady out of Houghton County. However, the contracts, so we're still trying to get a little bit of the language or the specifics. Our staff, all of our staff have been trained, completed the training process before Health and Human Services said, oh no, pick one. So all of our staff have completed the training and have their certificates. So we are very fortunate. The other 2 agencies still only have 1 person. So we have 3 trained navigators in our Sioux office, 1 in Newberry and 1 in St. Ignace.
So you're in pretty good shape.
We are very fortunate. Although there are many organizations, the Sioux Tribe, Bay Mills Tribe, I know War Memorial is in the process or may be completed to be certified application counselors. And again, they help go through the healthcare.gov website, can walk people through that process. But each organization is going to obviously offer services at different levels.
With the tribe, now are they for helping the public in general, or because isn't the tribe exempt from the ACA, like you said right off the...
Tribal members are exempt. However, the piece that they have to keep in mind is that they do not have to apply. They are an interesting population because they don't have to apply. However, technically, they are uninsured.
Okay.
A tribal
I didn't know if
entity
it was
is
under the
offering
Bureau of
healthcare
Indian
coverage through their clinics, but it's not an insurance. They can't just go anywhere and get services. So they can choose to apply through the exchange. There is also, for tribal members, if they're part of a recognized tribe and they have to prove that during their tax filing status, if they're deeming exemption, they actually can enroll. They have open enrollment anytime. There's no set timeframes for when they can enroll. So that is a different population. Sioux Tribe, my guess is going to be that they are going to serve their tribal population because it is tribal funded. Bay Mills is a federally qualified health center, so that is open to anybody within Chippewa County they provide services to. So they may help individuals beyond, they may or may not, depends on what their specific contract spells out. And then again, the hospitals that receive their designation status across the state will be helping, obviously, any other clients and the other patients. Yes.
And there's no cost to come see a navigator, yes?
Correct. Mm-hmm.
Who cuts your paycheck?
We got $15,000 as a sub-grant through, not Michigan, through Michigan Consumer, no. You have Consumers Mutual of Michigan, and then it's Michigan Consumers for Healthcare. Mm-hmm.
Right.
So Michigan Consumers for Healthcare received the federal grant through Health and Human Services to provide navigators and outreach and education throughout the state of Michigan. They did sub-grants to organizations throughout the state of Michigan at $15,000 to offer a part-time employee to be available on a part-time basis to do outreach and education and to walk people through the process. So it is definitely not I will never be able to reach everybody within this half of the UP. That's just not realistic. But by having our staff trained as certified, we also have certified application counselor status, so our staff members fall under that training category as well.
And through that funding source as well.
Actually, there is no funding attached to that. We all do this out of the goodness of our heart. No, I'm just kidding. We have funding that is a grant through, for indigent care. There are contracts with hospitals across the UP, and we work with the counties for federal funding to go up go up and be matched. They come back through the hospital. Contracts are with the hospital to provide care for the indigent. Because Medicaid expansion will be going into effect April, our funding will actually end March 31st. So we will be utilizing any new contracts that we can put in place with our partners, as well as grant funding and any reserve funds that we have to continue our operations moving forward.
No state or federal grants?
Ours is, it's actually through the Medical Care Access Coalition.
Through the hospitals in the UP?
The hospitals are contracted with the Medical Care Access Coalition, and we write a grant to them for those funds. So long, long crazy. The money
Long,
goes all over the place.
complicated.
Yes, yes. Do we have any more questions?
And if you have any other questions, certainly feel free to call me or email me, call Andrea or email her. And we appreciate you coming tonight, and like I say, this is what we know today. I wish we could be more concrete, and if we get further along, we find more concrete information, we'll have another one of these to get the information out. So,
Yeah.
thank you,
No, thank
Amy,
you.
for setting it
Yeah.
up.
We can give